Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about what are the different methods of to writing an introduction in OET writing. Because most of the students used to write their introduction like I'm writing to refer, I'm writing to refer, I'm writing to refer, the same pattern. So it is time for us to bring some changes in our introduction rather than following the old method. So here I have few methods of writing an introduction. So most of the people knows about that to make an introduction, we need three things from our case note. One is patient full name, and second one purpose, and third one what is the patient condition. So with these three key points, we will able to make an introduction. So rather than writing in the same pattern like I'm writing to refer, we have to bring some changes. So that's why I'm here to explain to you how the way we can, in a different method, how the way we can make an introduction. Okay, so let's move on it. So the first method, so usually we write I'm writing to refer, right? So here we can cut off the I'm writing to refer. So we can write Mr. EX. So Mr. EX, comma, who is recuperating from right knee fracture, full stop, who is recuperating from right knee fracture, full stop. He or she requires ear, continuity of care and management. This is one way of writing introduction. And second, the purpose of this letter is to refer Mr. EX, comma, who is recuperating from right knee fracture, full stop. He or she requires your continuity of care and management. So this is second method. So the third method. So the third method can be Mr. X requires your continuity of care and management as he is recuperating from right knee fracture. This is the third method. So the fourth method. In case if Mr. X requires a home visit. So how we can write? So this is the way. This is to request a home visit for Mr. X, who is recuperating from right knee fracture. This is to request a home visit for Mr. X, who is recuperating from right knee fracture. That's it. In case if our diagnosis query, so we are not sure with that, it is really a definitive diagnosis or not. So thereby, in that case, we can write an introductions. This is the way, like Mr. X, who has symptoms suggestive of respiratory infection, full stop. He or she needs your further assessment and treatment. He or she requires your further assessment and treatment. And what is another method? Like you can also write, this is to introduce. If we are writing this letter to the unknown person, so newly they are going to receive our patient. So for that receiver, we can use it like this also. This is to introduce Mr. X, who is recuperating from right knee fracture, full stop. He or she needs your further care and management or continuity of care and management. And another method, Mr. X is being referred for continuity of care and management as he or she is recuperating from right knee injury. So that's it. So these all are the different methods that can use in our introduction. So this is really different methods, rather than writing all the time, I'm writing to refer, I'm writing to transfer, I'm writing to transfer back, and I'm writing to introduce. So this is, rather than writing that methods, so we can bring some changes. So when the people is, when somebody is correcting our letter, they can see some changes when they are comparing our letter with someone else. So okay, this is something different way they are making an introduction. So how much in our letter, how much that uniqueness and how much like changes that we are bringing, not like in a norm, like not like everyone how they are writing. So this will be really helpful for us to score a good marks in our OET writing. Okay, I hope this all informations will be helpful for the students who are preparing for their OET exam, and also whomever wants to join to our class. Our number has given in description, because we have like for the beginners we have a classes, and also we have 40 days and 30 days, 60 days and mock batch. So we are running this all the package classes. So whomever wants to join for our class, you can call us at any time and you can join in our